Thank you to ACSM for providing the platform to present research in light of the COVID-19 pandemic. My name is William Gowers, a PhD researcher at the University of Kent in the United Kingdom. On behalf of my colleagues, I will be presenting our research on using EVH challenges to objectively monitor the long-term management of elite swimmers with exercise-induced bronchoconstriction. Research on a method to evaluate the efficacy of EIB therapy is limited in elite athletes. Recently, Jackson et al. Demonstrated an indirect airway assessment, the Eucapnic Voluntary Hyperapnea Challenge, can be used for this purpose in elite football players. To monitor EIB therapy, the EVH requires good test-retest repeatability. Stallman et al. And Williams et al. Have previously shown good short and medium-term repeatability of the EVH. However, the repeatability on an annual basis when used within an athlete's annual medical assessment has not been reported. This research aimed to investigate the use of the EVH to monitor EIB therapy in elite swimmers, and secondly, in those who discontinue therapy, evaluate the long-term test-retest repeatability. "27 elite international swimmers completed 2 EVH challenges separated by 12 months. You can see what this consisted of on the left-hand side, and there's a QR code for you to view an EVH challenge in action. Following initial withheld therapy respiratory assessment, EIB positive athletes were prescribed appropriate pharmacological therapy in accordance to greatest fall in FEV1. EIB positive athletes were asked to maintain EIB therapy leading up to the follow-up assessment. They were then retrospectively grouped based on adherence to this instruction, either adherent, EVH off, EVH on, or non-adherent, EVH1 and EVH2. Differences between assessments were analysed using a paired samples t-test. The test-retest repeatability between EVH1 and EVH2 was expressed as mean bias with 95% limits of agreement and a Pearson's correlation coefficient. Table 2 and Figure 2 show athletes who are adherent to instructions to use EIB therapy leading up to the follow-up assessment. Maximum fall in FEV1 was significantly lower in EVH on than EVH off therapy, despite no difference in ventilation achieved during the EVH challenge. Baseline FEV1 was also enhanced with use of EIB therapy, but forced vital capacity was not. Table 3 and Figure 3 presents the athletes who had discontinued EIB therapy or were EVH negative but with persistent symptoms. Greatest fall in FEV1 did not differ significantly between these assessments. A key observation is the number of athletes with EIB who returned to the follow-up assessment having discontinued therapy. However, this is most likely due to the timing of our assessments, with athletes anecdotally reporting that they had discontinued treatment due to cessation of training and competition, hence were not experiencing respiratory symptoms. There was good test-retest repeatability between EVH challenges completed 12 months apart in those who were EIB negative or EIB positive but withholding or discontinuing EIB therapy. This is shown in the Bland-Altman plot in Figure 4. Linear regression analysis determined there was no proportional bias as the distribution of agreement was not dependent on a reduction in FEV1. Figure 5 shows a significant strong correlation between the two assessments. In conclusion, the present study demonstrated the EVH challenge is suitable to monitor the efficacy of individualised pharmacological therapy in an elite swimming population. Active use of EIB therapy increased baseline lung function and reduced EIB severity. Furthermore, the EVH challenge demonstrated good test-retest repeatability over a 12-month period in elite swimmers who had discontinued EIB therapy or were EIB negative. Overall, the findings provide support for the EVH challenge as a follow-up assessment to annually evaluate the efficacy of EIB treatment following initiation. Follow-up assessments provide an opportunity to ensure EIB therapy is adequate, reinforce administration technique, show importance of adherence, and support education to athletes and staff. Once treatment is deemed to provide protection for EIB, intermediate baseline respiratory assessments could be implemented unless an alteration in EIB therapy occurs or there is an emergence of respiratory symptoms. Failure to appropriately manage an athlete with EIB presents a potential for airway health deterioration, exacerbation of condition, and subsequent reduction in performance or overall health. Objective evidence provided by the EVH challenge can support identification of other respiratory disorders, such as exercise-induced laryngeal obstruction, dysfunctional breathing, and prevent medication being prescribed unnecessarily.